We hope this short film will help prepare you for what to expect in the very last days and hours of a person's life. There may be several healthcare professionals and carers involved during this time. Everyone will work together with the patient and their family to make sure support is provided in ways that are important to them and their family, in line with their beliefs and values. Although we know that each family is different, many families feel it is very important to be with their loved ones. But sometimes this isn't possible or may not feel right. Everyone is different, and we will do all we can to listen carefully, respect your choices, and provide care and support that feels right for each individual. The process of dying is unique to each person. It is not always possible to predict exactly when a person will die. There are changes that signify a person is likely to be close to death. It is normal for these signs to come and go over a period of days. We would encourage you to talk to the healthcare team and ask any questions you may have. In their last days of life, the person may no longer wish to eat or drink very much or anything at all. This can feel hard for family and friends because we like to nurture and provide, and this is a sign that someone is entering the final phase of life. The healthcare team will review the person and assess if they are thirsty or dehydrated, and will develop a plan to ensure their comfort is maintained. If the person has medication to control any symptoms but can no longer manage these safely by mouth, they can instead be given by injection or via a very small tube that is inserted under the skin and may be attached to something called a syringe pump or syringe driver. It is normal for a dying person to be drowsy and sleep more. They may become less interested and have less energy to take part in what is going on around them. Their breathing may change. They may lose control over their bladder and bowel as their body weakens and becomes more relaxed. Their skin may look different and feel cooler. They may also drift in and out of consciousness. Some people become completely unconscious for a period of time before they die. This could be for a short time or for as long as several days. It is important to remember that even when the person appears to be sleeping or resting, they may still be able to hear. Speaking quietly, calmly saying the things that are important to those present, or holding their hand, reading to them, or playing their favourite music can be helpful. Simply being together can be a great comfort. Sometimes dying people may appear restless and may not recognise familiar faces. This is not a sign that they feel differently about you. As they drift in and out of a deep sleep, they may not be able to distinguish clearly between what is real and what is not. Quiet reassurance and the comfort of those who are close to the person may help. Sometimes people need medication to ease a symptom, so please ask for help. For most people, the final moments of dying are peaceful. Breathing becomes slower and more irregular with long gaps between breaths. Eventually, they take one breath out and do not take another breath in. They will stop breathing and the person's body will relax completely. Even when a death is expected, we can feel surprised or even shocked. There is no normal reaction to loss, so no matter how you feel, we will do our best to support you throughout this time and after the death of a loved one.